Over the last 24 hours, we have identified 1,539 new cases of COVID-19. We have completed about 13,700 tests, and our positivity rate currently stands at 11.4%. As cases rise, we must keep wait times for testing as low as possible. That is why, along with increasing staffing and clinic hours across the province, where demand is high, we will shift back to offering just one test for all close contacts when they have no symptoms. Starting today, close contacts will be offered testing as soon as they are identified. If they experience symptoms at any point after that first test, they can get tested again. Otherwise, they must remain in quarantine until 14 days have passed, and as of today are no longer requested to have a second test. If you have a second test booked and have no symptoms, you can cancel this appointment to free up capacity in the system and shorten wait times for others. If you have a second test booked and you have symptoms, please keep your booking. Testing remains a critical part of breaking the chain of transmission. We have identified 812 additional cases of variants of concern in the last 24 hours, with variants now representing about 63% of all active cases. For the previous week, the R value for the province was 1.04. This includes 1.1 in the Edmonton zone, 0.98 in the Calgary zone, and 1.05 for the rest of the province. It's good to see that growth rates have declined, especially the decline from 1.06 to 0.98 for Calgary, but our numbers are still very high, and it's important to underline that cases are still growing, especially in Edmonton. Simply put, we are still heading in the wrong direction. There are now active alerts or outbreaks in 712 schools, which represents 29% of schools in the province. We continue to see rising hospitalizations. There are now 635 people in hospital being treated for COVID-19, including 143 in the ICU. Sadly, 7 new deaths were reported to Alberta Health in the last 24 hours. My thoughts are with the family, friends, and colleagues of these individuals, and anyone who has lost someone they cared about due to any cause. There are now 20,721 active cases in Alberta. That is the second most number of active cases since this pandemic began. There is no one source or sector that is driving this spread that we're seeing. It would be simpler if there were just one cause. Instead, the virus is spreading through all of us and the many in-person get-togethers, meetups, and other interactions that we have with other people every day. That is why public health measures are in place for a wide range of sectors, and why we all must continue to limit in-person interactions as much as possible. We have now administered more than 1.46 million doses of vaccine in Alberta, including almost 30,000 in the last 24 hours. That means that around 26% of the people in the province have received at least one dose of this vaccine, and about 6% of our population is fully vaccinated. Every day, more people get immunized, and that's a good thing. However, as more people get their shot, I want to stress that getting the vaccine does not mean that the rules no longer apply. Whether you have 1 or 2 doses, you still need to be careful. No vaccine offers 100% protection. Getting your dose makes it less likely that you will experience severe illness, but it's possible that you could still carry the virus and be contagious to others, even after your immunization. Right now, with the vast majority of people still not immunized with even 1 dose, it is essential that anyone who has had the vaccine continue to follow all the public health restrictions in place.